Baby Osinya will certainly need the services of specialists in neurosurgery, but his fate has once again revealed the sad tale of the state of public health care here in Kenya. This is a number that might shock you. Kenya has only 16 registered neurosurgeons. Here's Wilson Buru to tell us more.
The Oxford University defines neurosurgery as the surgery performed on the nervous system, especially the brain and spinal cord. As one would imagine, literally getting inside somebody's brain is no child's play. In fact, it is so challenging that there are only 16 neurosurgeons in Kenya, 13 of them based in Nairobi.
So the patients would usually come through here.
We meet Dr. Peter Wanyoike at the Kenyatta National Hospital. He's a neurosurgeon and one of the doctors who will be operating on baby Osinya. Dr. Wanyoike says he sees an average of 30 patients a day. Of these 30 cases, up to 3 of them have to go under the knife. So, what does it take to train one neurosurgeon? First, there is the duration.
From the time that one enters medical school to the time you are a registered neurosurgeon. When we trained, it used to take about 17 to 18 years.
Then, there is the cost.
If you count that for 6 years, you can say that's about 4-point-something million, isn't it? Now, that's excluding this person's requirements. You need to buy books, computers, so accommodation, so it's a bit expensive.
Dr. Ruben Lubanga has been a neurosurgeon for the last 22 years. He says most students need to start taking neurosurgery if Kenya is to get enough experts. He also says in case there is a mass need for this service, then there is always an alternative.
Many of our students right now are very easily able to do basic neurosurgical evacuations by the second year of their training.
For the patients, it's not any easier either. The doctors are a rare commodity. Unless it is an emergency case which would have to be operated on in 12 to 24 hours, the waiting list for one neurosurgeon can stretch up to 6 months. Then, when it's your turn, there is the hospital bill.
An average neurosurgical in the hospital here would probably cost about between 300 and 300,000.
An average of 300,000?
Yes.
That cost gets way higher when the surgery is performed in a private hospital. Being a neurosurgeon is clearly not an easy feat to achieve, but 15 neurosurgeons in all of Kenya is nowhere near enough to cater for all the patients requiring this critical service. Wilson Buru, KTN, Nairobi.